this room now. Hello, my name is Lee, and I am the individual who will be taking care of you today. It looks like we have you on the schedule for a breast exam. You want to learn how to do self-breast exams? Okay, yeah, absolutely. I think that's fantastic. Are you having any active concerns today at all? You've just never been taught how to do them? Okay, yeah, no problem. I can absolutely do that for you. All right, well, how about we run over just a few questions in your chart, and then we could do the breast exam for you, and I can kind of walk you through how you would do it at home. Awesome. As far as medical conditions, are you currently actively taking therapy for anything, any medications, supplements that we should be aware of? Any hormonal birth control? What about surgeries within the past 5 years? Okay, and then do you smoke or drink at all? And any family history of cancer? Okay, and what side of the family? Mom? Both of them? Okay. And you said breast cancer? Okay. And do you know roughly how old they were? Yeah. Okay. Really? Okay. And do you by chance know if they ended up getting genetic testing? First one did. Not sure of the results though. Okay. Yeah, no problem. I can definitely understand why, for sure. And then as far as your breasts go, you've noticed no new changes, no lumps, concerns, anything like that? Okay, just want to make sure. All right. So the front desk printed off how to do self-breast exams, this information sheet. So I figured I would run over it with you while also doing the breast exam. I think it is important to note that depending on the resources you're looking into, there are some people that don't necessarily advocate for self-breast exams. My personal opinion, I think they're fantastic. Speaking on my own personal experiences, I think that it's so important that we become familiar with what our breast tissue feels like so that we're able to potentially diagnose things earlier, especially if we're younger than age 40 where we're not getting routine breast cancer screening. I think it's a great thing to start getting in the habit of when we're in our 20s and 30s. You know what I mean? Yeah, so I'm a huge advocate for them, so I agree with you. I think it could definitely catch things early and we'll just be on the safe side. For sure. Okay, I'm just going to put some sanitizer here. And I do just have to get your blood pressure and temperature before we do our breast exam today. Do you have an arm preference? Okay, just want to make sure. If you wouldn't mind, I'm just going to slide your arm through there. There you go. Just going to listen real quick. Don't mind me. Okay, just rest your arm for me. Pressure is normal. Just put that around here. Let's get all that extra air out. Okay. If you wouldn't mind sliding your arm out. just going to pack this up and I will do a quick temperature check. Let's do a temperature check here. Kind of keep everything in my little box. And this is a sublingual temperature, so it's going to go underneath your tongue, okay? Awesome. Garbage. Alright, if you wouldn't mind just sticking out your tongue, this is going to go right underneath. Pardon my reach. Alrighty. Alright, temperature looks good. Let me just grab the sanitary wipe. Just to remove this. Vitals look good. Do you know approximately how tall you are? Okay, cool. Awesome, awesome. Alright, let me just kind of clean this area up and then we will run through that self-breast exam packet together here. Alrighty, let me get some gloves. Do you have any questions before I do your self-breast exam? Or sorry, show you how to do a self-breast exam, but do your actual breast exam. Okay, cool. And are you comfortable with me untying your gown for it? Okay, awesome. Just don't want to assume. Alright. So let's go over this form together then, okay? So basically in the first few pages of the form, they discuss how, it could increase odds of early detection is what a lot of people do believe as far as why we may advocate for self-breast exams. So really, first and foremost, when you're at home alone, you'll want to take a look at your breasts, both your right and your left, in the mirror, just to kind of note size discrepancies or any changes as far as the way they're shaped, or if what they call asymmetry, like one breast is significantly larger than the other or a different shape than the other. Now, of course, some of us may have that naturally. A lot of it is more of seeing changes, sudden changes in the breast where we get concerned. So you want to note for any unusual size, shape, color, if there's any visible distortion or redness or swelling in one of the breasts. Basically, you're kind of looking and saying, has my breast changed in appearance where it seems a bit not normal for you? Okay, now the next part is when you're actually standing up while you're looking, you also want to take into account your axillary lymph nodes, as some of us can have breast tissue that kind of extends that way. So you'll want to put both arms up and then assess that area as well to see if there's any visible changes there. Now keep in mind, all of this is when you're not even necessarily physically examining yet. It's more visual. Does that make sense? Good. Okay. So, one thing you're also looking for if there's any nipple discharge or fluid coming out of the breast, okay? Yeah, so all of that seems pretty straightforward. Now on step 4, this is when we're going to be feeling for lumps. And so we all sort of have our different techniques. I'll kind of show you what I do right now with examining yours. You let me know if you get uncomfortable. But if you are someone, I think everyone should do it, but especially if you're dense, I always recommend doing a breast exam once a month, lying down as well as sitting up. Something I've personally experienced is there are things that I can feel in a lying down position versus standing up because the tissue can shift a little bit. So just something to be mindful of. So basically, I'm just going to untie this here. We'll keep you covered on this side for now. I'm just going to release this side. And then you are just going to kind of do a self-breast exam, like how I'm examining you here, okay? So we can kind of start up here. Just kind of like moving tips of our fingers around the breast tissue to see if we feel anything. And by anything, I'm talking, you know, like kind of balls or lumps underneath the skin. Now, some of us are a bit more fibrocystic, or we just kind of feel dense, or kind of like we have a bunch of cysts all the time. But when you keep a routine going, you sort of become familiar with what your normal feels like. So it could definitely be challenging for some of us, don't get me wrong. But any pain at all? And I could read you what's on the patient education form here after I finish this breast exam. Yeah, I try to essentially make sure that I'm not missing like a surface versus kind of going like up and down, and you can skip sections of your breast. It's more of like a roll method, I would say. Can you lift this arm a little bit? Thank you. Okay, this breast is done. So let me kind of read off to you how they explain it. You use a firm, smooth touch with the first few finger pads of your hands, keeping your fingers flattened together, and you kind of move them around in a circular motion. I guess that is the best way of explaining it. Cover the entire breast from top to bottom, side to side, and from your armpit, okay? Make sure you're covering the whole breast. Use firm pressure, especially if you are more dense, just to get deeper in the tissue. I think that is an important thing to know for sure. And basically, they say you're just looking for lumps. If you're always ever not sure, definitely come in, okay? It's always best to be safe. I'm gonna remove this side now, and then we'll do the same thing on this side. I am gonna have to untie this side here just to make that a little bit easier. All right, pardon my reach. Same thing, kind of circular firm movements to see if I feel any lumps. You're doing good. Any pain when I'm doing this? Good. Okay, if you could lift this arm a little bit. There you go. Okay. All right, and this breast also has no notable lumps today. Now let me just tie up your gown here. Now keep in mind, we did this examination in the office lying down, just as most of them done in standard OBGYN practices are. But one of the things that I find to be so important is, again, doing a breast exam lying down, but also standing up, which they don't often do in clinics very much. An example I always use is myself. I ran for my annual early in the year, had a breast ultrasound for other things. Again, I'm very dense, so I'm just very cystic. But then when following up, I did a self-breast exam at home and found a lump that wasn't noted at the time of my annual. And I attribute that to the fact that, again, I'm able to examine myself in different positions rather than just lying down. So it's so, so important that other than just your annual at the OBGYN, you're checking month by month, because things do change and we can feel sometimes better, you know. So always keep that in mind, okay? The last page of this packet goes over doing the same thing while standing, typically in the shower. And then, like I said, you'll want to do it once a month, maybe like a week after your period. Yes, exactly. Does everything make sense as far as what we talked about with the breast exam today? Good. I just want to make sure it's super clear and simple. I will actually make note to also send it to your portal, just in case you lose the papers I'm about to give you. I could send it to your portal for you that says the same exact things. Let me just put some sanitizer here, but I am going to give you this packet that I was reading off of, just so you have it. And then you should be all set today. Of course, if you need anything or if you feel like you feel something, always come in. It is never a bother, okay? Yes. All right. Well, I am going to leave this there for you. Is there anything else that I can do for you today? You're all good? All right. Well, it was a pleasure seeing you today, and I hope you have a good one. All right. Thank you. See ya.